it was a very unexpected uh, message that I received from my doctor. I felt healthy. I had not shown any symptoms that would make me concerned that I had a health issue. We had been tracking my prostate-specific antigens, PSA levels, for some period of time, and knew that because they were elevated, we finally made the decision to do a biopsy. And so I was walking back into my doctor's office purely for the purpose of having him to say, "We looked at your biopsy, and there was nothing there." And the way he described the results kind of tricked me for a second. I don't mean to say he tricked me in a way that he was doing something deliberate, but I became comfortable because he said, "We didn't find anything here, we didn't find anything there, we didn't find anything here, but you do have cancer. We found that it's very small, it's very early stage, easily treatable." There must have been some change in my expression because he took pains to assure me that this is treatable, not something that I need to be concerned about. I asked a series of questions from a medical standpoint. What can I expect next? Will this have any impact on me? He did ask that I have anyone there with me, and I did not have a person physically with me, but I did not feel alone. I am a person of faith, and I did, before he came in the room, I prayed, and as he was talking to me, I still prayed about what I would hear and how that would play out. My doctor took some time to explain to me what my treatment options were, and then he gave me some documents and some discs to take home with me to share with my wife that we could look at to make the most informed decisions that we could. He did focus a little bit on the Da Vinci method because it was a less invasive form of surgery that had less complications, less side effects as reported, as opposed to a radical prostatectomy that would have me under for some period of time. So it was a day that I thought about things for a while. I went home for a little bit because I was at work. I went to see my doctor in between appointments. I went home for a few moments. I called my wife. I called my children. And then throughout the day, I called my siblings because I wanted them to hear it directly from me. But I didn't shed a tear or anything else because to me it was something my mindset was on, well, what am I going to do to resolve this? And so that's how I approached it. I had read about proton therapy some years before. There was an article in the local newspaper. And when I looked at the list of treatment options that the doctor had given me, I recall seeing proton on that list, but as he went down the list to describe things he recommended I do, that one really was not touched on. So I had no other treatments prior to then. And between July and when I was diagnosed, and maybe sometime in early August, because of the job that I do, which involves giving grants to foundations and community agencies, I had a lunch meeting with someone from Hampton University who I worked with in other cases before, and we were meeting to discuss my company's support for a fundraising gala for proton therapy. And as he was describing proton therapy to me, and she mentioned this has a lot of success with prostate cancers, it was like, oh, really? And I revealed to her at that time that I had been diagnosed with prostate cancer. And from that meeting, which was over in the Peninsula Center, Town Center, from that meeting I got in the car and drove directly over here and met staff and made the decision that I wanted to pursue this as opposed to some of the other options. I am a person of faith, and I don't believe that any of us know exactly when God will provide the things that we need. When I was sitting in the room getting this diagnosis and for some period of time afterwards, I prayed. about this. I talked to members of my church, and it happened by coincidence that I was having a meeting with a colleague from Hampton University as she was asking me questions regarding my company's ability to support a fundraiser for the Hampton University Proton Therapy Institute. That in that meeting, that I believe was providence, that it happened that God put her and me in the same place at the same time, where she revealed to me this option that I may not have considered, may not have been aware of, was not aware of until she brought it to my attention. I did recall that I'd seen an article some years ago, but as she talked about the successes and the camaraderie and how the patients are treated, it really piqued my curiosity, so much so that I got up from that meeting and came directly here and got a tour that day, cleared my calendar at work, got a tour that day, and went back to my doctor to say that I'm interested in this option. He was okay with it, but he didn't embrace it enthusiastically, and I believe it was simply a question of him not being as familiar with proton therapy as he was with other treatment options. And I did go, even after I was aware of proton therapy, I did see on a referral a second urologist who was a surgeon to get his opinion. And he described the proton therapy as being an option that I could consider that it was no more, no less successful than some of the other treatment options, and it was purely my choice. I found out about the Proton Therapy Institute on a day that I think it was preordained, it was fate. That I met with someone who revealed to me about the Proton Therapy Institute, and from that meeting I left and came directly to this facility and met with staff and made the decision that I wanted to pursue this option for my medical treatment. And you know, the thing about the treatment options that proton therapy provided over the others that I have been exposed to, by my physicians, was that it was because of my lifestyle. I work for a major defense contractor. I travel a lot. I have a very compacted and very intense daily schedule, and I was adverse to. First, I wanted to make sure that my health was being taken care of. But it would have been difficult for me to be out of pocket, out of office, out of commission, if you will, for 6 weeks or more. And so I liked this option for that reason, but I also liked it because as a person who considers himself to be fairly physical, I didn't want to suffer physical limitations over an extended period of time, and the proton therapy treatment option was one that was non-invasive and allowed me to be able to continue my lifestyle as I normally do. I'm a retired military officer, and one of the things that I had become a part of my lifestyle is working out in the mornings, riding my bike, some resistance training and other things. And I was very adverse to any kind of surgical procedure that would take me out of commission. When I got into the treatment with proton therapy, for much of that treatment, I didn't have to change anything that I was doing. Towards the end of it, and the doctors had warned me that this might happen, my energy level had gone down some. But within 2 or 3 weeks of completing my procedures, I was back in the gym. And that was something that I really, really wanted to be able to continue and to maintain. My experience at the Proton Therapy Institute as a patient was second to none. The facility is appealing to look at and to walk into. It's bright and it's cheerful, it's inviting, and that was important to establish, not only for me as a patient, but for other patients, to help to establish a more comforting mindset and attitude as you walk in. But the most important part was the attitude of the staff, from walking in the front door and being greeted by the receptionist to going to the waiting area with my fellow patients, and how the radiation team members, for each of us assigned to the particular rooms that we're in, how you developed somewhat of a personal relationship with them over the time that you were going through your treatment. I always felt like I was treated in a very, very special way, and so did every other patient. And the other part of that experience was you became a part of a fraternity, if you would. Watching the other patients as they went through their treatments and as they graduated from the program, and the little celebrations that took place, that included not only the radiation technicians, but other members of the staff that came back and celebrated your accomplishment. And it became something that each of us looked forward to. You had your countdown. I'm only 20, I have 20 more to go, 19, 18. And when it gets to be your day to ring the bell and to say, I've completed my treatment, it was a special day. We each celebrated with and for each other. It was a very, very heartwarming experience. The doctors at the Institute impressed me with their depth of knowledge about proton therapy, and the fact that they were so darn busy. They were receiving phone calls from the teams as someone was on the table, as we refer to it, getting ready to undergo their treatment. They would call the doctor who's on duty and verify the settings, and he would give them permission to move forward with the treatment for that person. But when I'm on the table, I want to know that everything's set and that the doctor has approved my team moving forward. And so it was something that you came to expect. But their level of care and concern for you, and you met with your doctor once a week, and sometimes it was a fairly quick meeting. It was for me, because I really didn't have very many symptoms that were problematic for me, and so it was check my weight and check to see how other things are going for me, and normally it was a fairly quick meeting for me, but very thorough nonetheless. Well, the staff at the Proton Therapy Institute really make the experience worthwhile. From the doctors to the supporting nurses to the persons on the administrative staff who took care of all your insurance requirements and those things. Everyone knew you by name, spoke to you, smiled with you, and everyone became involved in the progress of your treatment. I had folks who didn't know where I was every day that came back and said, how far along are you? And even when I was completed with my treatment, and I would say, well, I'm done. My, that was really, really fast. You were here and gone. And as I've come back for follow-up and people recognize my face, they still greet me the same way. As I came here today for this interview, two gentlemen from the janitorial staff came by and shook my hand and said they were happy to see me again. And so there's no patient is too little or too big to be greeted with a smile, and that's extremely important. One of the personality traits that I have is that I'm very inquisitive, and I do take great pains in being involved in any medical treatment that I might have. When I was first introduced to proton therapy and was starting to consider it as an option, I became the king of internet searches on proton therapy, and developed, I think from a layman's standpoint, a fairly good knowledge of what the process entailed, and was able to compare it with video and other things that talked about other treatment options, even diagrams of surgeries and what the potential side effects were of those surgeries. And so I believe that I made an informed decision based on what was best for me. As much as I thought I knew, when I came here as a patient and started to undergo the treatment, I realized that I still didn't understand it as well as I thought I did. But what I did appreciate was the fact that I could leave my office, drive here, go to the dressing room, take my street clothes off and put on my gown, if you will, and go into the treatment room and meet a group of pleasant people, get on the table, have all the set up, have the treatment, go back and get dressed, and drive back to work in about an hour and 10 minutes. And there was no there was no pain or no discomfort associated with the actual treatment. And so for me, I really didn't see any other options. And the proof in that pudding still, though, is that I did the research and made that decision for myself. I've had other friends and family members to call me since my treatment and ask me questions about proton therapy, and I've given them the information as well as the other treatment options that I became familiar with, and invited them to do the same things that I did, which is do the research, make your own decisions. But for reasons that I described to them, I believe that proton therapy is clearly the best option when you're able to find the cancers early, and you're able to treat just that one small area without having the uncomfortable side effects of dealing with more invasive kinds of procedures, whether that procedure be radiation, brachy seeds, or surgery. I've tried not to proselytize, if you will, but I'm certainly sold on proton therapy as a viable treatment option. My enthusiasm for proton therapy and my absolute commitment to the value of proton therapy over others makes me guarded in some cases, because I don't want to deny the other person the same option that I had, which is to research and make your own decisions. But if I'm asked, would you do this versus that, I always say proton therapy. Of all the treatment options that may be possible for any patient who is in their early stages of detection of cancer, I would recommend proton therapy. One, because it's less invasive. Two, because it doesn't disrupt your lifestyle. And three, because it's proven to be a very efficient and successful methodology for addressing early stage cancers, and cancers that are very defined, localized cancers in very, very specific areas. I'm great. Started working out again. I was tired for a couple of weeks after the surgery. I went to work every day, and I had the same hectic schedule of working during the day and attending community events in the evening. But the difference was when I went home at night and I went to sleep, I crashed. And I didn't have the energy when I woke up in the morning to want to do my morning workout. I was good to take my shower and shave and get my clothes on and get to work. But after a couple of weeks, my energy levels started to come back, and I'm enthusiastically back in the gym. Friends and family would talk to me sometimes about how many treatments do you have to have and how long does it take? And they were always amazed when I told them that I could literally get up from my desk, go to my treatment, and then return, and that whole cycle took about an hour, 10 minutes, maybe an hour and 15 minutes if we started on time. And I think that's a value add for any patient that wants to consider this treatment. You're not laid up in the hospital. You're not recovering from surgical incisions. You don't have 3 weeks to 6 weeks, depending on the procedure that you used or that you adapted for your treatment option. Those things just weren't present. So to me, it was almost too easy. And my wife and I had a discussion, and she said, "Don't forget that you're sick. You have cancer." And I corrected her and said, "I'm not sick. Sick people are in the hospital. I have a disease, and the disease is being treated, but I can move forward really without any interruptions to my lifestyle." I took 1 day off of work on the first day of treatment and 1 day off on the second day of treatment. Other than that, I never missed any work. 1 day off on the last day of treatment, I'm sorry. I want to correct that. Front end and back end, that was it. On the day that I received the diagnosis, there was a lot of uncertainty. I wasn't afraid, but I didn't know what the future held. There was this thought in the back of your mind for any person when you hear that you have cancer, is this going to be something I'll be able to get over? I didn't allow myself to think about that for a long time. I started thinking about what it is that I can do to solve this. Now jumping forward to today, I've undergone cancer treatment using proton therapy without any visible side effects and some discomfort in terms of my energy level and other things. On the day that the doctor told me, Mr. Harris, you have cancer, there was a lot of uncertainty. And I didn't know which treatment option I was going to undertake. And so that was the toughest part for me and for my wife. But looking back on that, if I knew then what I know now, and what I actually try to impart to others is they have been referred to me by other friends who said, well, you got to go see Chavis. He went through treatment. And I would tell them with absolute certainty, set that worry aside. There's something out there that I believe can be helpful to you that can not only change your life in terms of your concern about your future prognosis with the cancer, but also keep your life where it is, in that if you're healthy, you don't have to suffer a big swing one way or the other because of this treatment option versus others. On the day that I was diagnosed with cancer, there was a lot of uncertainty about what the future held. I wasn't afraid, but there was certainly a lot of uncertainty and trepidation. Today, I would tell another person going through the same thing and being in the position that I was in on that day, there's nothing to worry about, that this treatment option with proton therapy is one that can take that worry, that uncertainty away. If someone asked me who was in the same position that I was in on that day that I received my diagnosis, if someone asked me for advice, I will tell them don't be concerned about it. That there is a treatment option out there that will work for you. In my research prior to my receiving treatment, there was an article where proton therapy was referred to as the holy grail of cancer treatment. I thought that was kind of over the top when I read it, but then once I started to receive the treatment, I really believe that it's cutting edge. It's a kind of treatment option that changes the way we even look at options for treating cancer going forward in our future. One of the things that I've had to really remind myself of, and as I've had discussions with my wife, we have to say the words out loud sometimes. You had cancer. But the treatment for me was so non-invasive, both physically and to my lifestyle, that it didn't feel like I really went through anything other than the small side effects towards the end of my treatment. If that was an option for me, as opposed to, and if I would say this to someone else, if you have the option of having that mindset, I have to remind myself that I went through treatment. I would rather personally go through that mindset than to suffer 6 or 7 weeks of recovery and maybe some side effects that can last for more than a year, which are things that I've heard are associated with other treatment options. And so for me, there's no other really sensible option for a person with early stage cancers that is localized than to use proton therapy for your treatment. One of the interesting things that's happened as I've gone through this treatment is that I'll tell someone I'm a cancer survivor, or at the time I was undergoing treatment, I'm undergoing cancer treatment at the Proton Therapy Institute at Hampton University. And invariably someone would say, oh, but you look so good, because their expectation is that there would be some physical manifestation, some of the uncomfortable and unhappy side effects that we associate with people who have cancer. And for my coworkers and for my family members and for my church members, there were some who would come up and ask me, are you done with your treatment yet? You look great. Have you started? And when I tell them, I've only got 4 more treatments to go, or I finished a month ago, they're always surprised. There were coworkers who knew and put the sad expression on their face when I would say, I have cancer, and they would do the, oh. But for me, it was like, no, there's no need for that. It's an opportunity for me to look at my life and look at myself as a person and make some adjustments, because I've been given something with this proton therapy treatment that others don't have the opportunity to do. I was asked by a church member, how did you feel when you got the diagnosis? And my first reaction was, why me? And then as I thought about it, I changed that to why not me? If I'm a person of faith, then I'll be the example for others to look at to see that if you have faith and you're smart enough to pick the right options, which I believe proton therapy involves, then there's nothing you need to be concerned about.